Of course.
Mine might not be.
I don't know where
Where
yours
is it?
is.
Maybe I didn't bring my phone.
What do we need?
Turn your phone off.
Oh, my phone's in my. It's in my coat. Okay. My name is Natalie Mara, and I'm the Executive Director of the Ontario Health Coalition. Thank you for joining us today. We very concerned, obviously, about the hospital cuts that are happening across Ontario. All across Ontario, we're seeing the deepest hospital cuts that we have seen, at least in a decade or more, perhaps ever. And because these are cuts on top of cuts on top of cuts, the cuts are cutting ever deeper into needed hospital care for patients. The worst cuts and closures across Ontario continue to be happening in Niagara. And with the proposal to close 5 entire community hospitals serving approximately 300,000 people in the Niagara Peninsula, Niagara is facing the most severe hospital cuts and of the entire province. We are deeply concerned that if these cuts are allowed to go ahead, despite the clear evidence of patient need for those services, that this will pave the way for a slew of hospital closures across Ontario. We looked at the documentation that was provided to the Minister of Health, then Minister of Health Deb Matthews, who approved the plan to close the 5 hospitals across Niagara, and we thought it was extremely flimsy. And so we asked an international health policy expert, Dr. John Lister, who's a professor at the University of Coventry in the UK. He has 20 years experience. He's written 2 books on global health policy reform and has 20 years of experience in reviewing government planning documents regarding hospitals and health reform. And we asked him to look at the documents pertaining to the plans to close all of the 5 hospitals across South Niagara and the eastern side of the Niagara Peninsula, and to tell us how they compare to government planning documents that he sees in other jurisdictions. And so I'm pleased to have John Lister in. He's here by video conference with us today from Cornwall in England. So this is Dr. John Lister, and he'll cover the main points that he found in his review of the documents.
Okay, I'm on. Yeah. Okay, well, thank you. And just one short correction. I've been doing this for 30 years, reading these documents, and this is by far one of the weakest documents I've ever seen in my life. And I'm actually shocked at the level it's written at, the total lack of any supporting evidence, any evidence that anybody's actually been consulted from the local community on these questions, and just the way it's written in the first person, it almost seems like a sort of a personal blog or a memoir rather than a serious document purporting to be a plan for local health services. And the second big thing, which comes out even more so with more recent figures that have emerged, is that the document, the starting point is hospitals which are too full. Hospitals which are 93% occupied at the present time, and the proposal is to actually reduce the hospital capacity to push that level to 97%. Now, in England, it's regarded as a serious problem if acute beds are more than 85% full, and there's a substantial literature looking at the consequences when hospitals run at more than 85% of capacity, because it does mean once you're hitting 90%, it's guaranteed you're going to have moments when the hospital has more patients than beds, and a crisis situation can develop. And bear in mind that we are now talking about hospitals which are caring for fairly vulnerable people, in particular the one in Niagara on the Lake with complex needs, and the idea that beds would not be available and that you'd actually squeeze resources and limit the availability of these resources to this vulnerable population is extremely worrying, especially when there's no explained system on which this might now operate to take place. And the underlying thing in this document is there is no the missing elements are quite basic, which is an analysis of how many people, what the population is, what the demographics are of that population. And in particular, given that we're talking here mainly about hospitals that deal with older patients, then what is the size and the dynamics of that older age group? Is an expanding proportion, as it is in Niagara-on-the-Lake, an expanding proportion of the population? And from that, and what are the main health issues that need to be addressed in the hospitals as presently configured, and to what extent can those needs be accounted for through other means? There's no analysis of that at all. You might also expect an analysis of how far it is to go to an equivalent hospital or to find the services that people need once the hospital in Niagara-on-the-Lake is closed. I'm just using this as an example because it's the first one, but it applies to all of the 5 hospitals. There's no proper analysis of how far people have to travel to access alternative services. And of course, in that area where public transport is not strong, and it's described in one of the documents from one of the consultants that was brought in as auto-centric. In other words, it revolves around the use of the private car. Well, a lot of older patients either can't drive cars themselves, or if they actually need hospital treatment, are not able to drive themselves, and may well not be able to access other forms of transport to get there. And of course, people visiting them in hospital, and if we're looking at people with more complex needs in these type of hospitals, they tend to stay in for a while. People visiting them are also going to have to travel across to them. So there's also those questions about access and what the implications are of having to go further distances. So I think that they're specific. And then we come on to the question of how these hospitals services are supposed to be re-provided. And we're told a minimum of 6 years from the time the document was written. And we know from experience everywhere around the world that 6 years tends to become 10, tends to become more. But a minimum of 6 years, even according to Kevin Smith's forecasts, before the alternative services are actually built. And we're talking about a new hospital, which there's no funding identified, there's no actual schedule for doing it, and no clear agreement to do it. And a site has been located, suggested, on the edge of Greater Niagara area, which is a site with virtually no local population at all. Now, this is the most bizarre idea, to build a brand new hospital in the middle, literally in the middle of no population, which means you've not only got to transport all the facilities there and all of the staff who are going to staff the hospital. Everybody who visits that hospital who needs the treatment there will have to travel that distance across to that location. And there's no rational argument presented as to why it should be presented there in the middle of nowhere. Normally, you would place a hospital in a centre of population. That's the standard way to do it. In fact, there's a reference in one of the documents to the taking regard to the concentration of population. Well, it seems to be notice where the population is concentrated and put the hospital somewhere else, because it doesn't actually follow that rationale at all. So I think we have a whole series of very serious flaws in this approach. And I do have to say that although we have some pretty imperfect documents presented to us in England and the UK by governments proposing to drive through proposals, I've never seen one quite as bad as this, and quite as callous in disregarding really the interests and the concerns of local people. There's no evidence. There's talk about Kevin Smith having spoken to various people, but there's no names are presented, no evidence that actual conversations have taken place. There was no formal consultation whatever on the actual proposals that are put forward there. Now, that is most unusual, and here you would not be able to close any facility at all without a formal consultation period. And the standard for that would be a 3-month period between the launch of the document and the responses being invited from all the local community organisations. That would be local government, the local councils, local community organisations, patient groups and users, and quite often religious groups and other people in the locality will submit their views. Quite often with a contentious thing such as disclosure, you would have campaign groups which would also submit petitions and their own responses. Now, that's part of a process which is normally acknowledged to take place, as I say, over a 3-month period. in England, we just had a new emergency procedure brought in where hospitals are in serious crisis, and that allows for a 1 month consultation, and the whole process from proposal to closure is a minimum of 4 to 5 months. Now, even there, and that is an exceptional arrangement. So we have here a complete breach of all those basic requirements, that the population is consulted, the population is convinced by the new proposals, and that the new proposals are adequate to deal with the local population and are going to ensure a sustainable and I'm talking here also environmentally. Think of the carbon impact of all of that extra travel across to the new site from the places where people currently have local access to hospitals. They will now have to travel to this new hospital instead, and that includes the staff as well. I'm amazed it's got this far. I'm amazed people are actually talking on that basis of closing hospitals. And I'm also, very keen to see that even if Niagara on the Lake has actually passed the point of no return, although it shouldn't be, even if that is the case, then I certainly think the other 4 hospitals certainly need to be, the question has to be raised urgently, because this is a flawed process, a flawed plan, and it's a bit of an insult to local people to push it through in this way.
Okay, thank you very much, Dr. Lister. Next, we have MPP Cindy Forster, who is the MPP for Welland, and has, normally we actually don't do press conferences with any particular political party. In this case, the local MPP Cindy Forster and Wayne Gates have really been very, very active in their communities trying to save the hospitals, and so we made an exception.
Thank you, Natalie. And thanks for the opportunity to be here today to speak to this important issue. My riding actually includes Welland, Port Colborne, Wainfleet, Thorold, and the southwest end of St. Catharines. My hospital in Welland is slated for closing. The Port Colborne Hospital has already closed as a hospital. It is considered, the H is gone, let's say. It's considered a kind of urgent care center with some complex continuing care beds in its site, along with Fort Erie Hospital, the same situation in Mr. Gates' riding. As a registered nurse who worked frontline for many years in Welland and Port Colborne, I hear concerns every day from my constituents. Everywhere I go, they are very concerned about the health cuts across the Niagara Peninsula. When I visit retirement homes in my community, the first things that residents there say to me is, please save our local hospital. I was happy to see Dr. Lister's report, a health policy expert, because he's validated the concerns of the constituents of South Niagara, Port Colborne, Welland, and the surrounding areas that service the needs of the people in our community. His report also supports what the mayors and the city councils have been saying in Welland and in Port Colborne and in Wainfleet. I think it's unprecedented that in Canada or anywhere in North America that anyone would be planning to close a hospital that supports a population of more than 100,000 people. Niagara has wait lists for community personal support care. The current wait list is 114 people, but that number has been as great as 500 in recent years. There are 1,400 people on the wait list for long-term care beds across Niagara, and some of those waits are as long as 3 years. And we have the second highest population of seniors by percentage of population. I have to tell you, the Niagara Health System has been under attack from the day it became an entity. There were 8 robust hospitals operating in the Niagara Peninsula just over a decade ago, who have probably lost 55 to 60% of their beds, if they're not already closed. And it was the largest healthcare system in the province. We have had more changes in the Niagara Health System than probably all of the health systems combined in this province. A plan that will see 5 hospitals plan to close. So the report validates the recommendations are wrong. They're not substantiated. They were made without broad public consultation. They were made without regard to demographics or the needs of the population. They were made with outdated data. They were made without regard to recent population growth studies that show that the population in the south end of Niagara is actually going to grow by up to 28% over the next 20 years. They were made without regard to the socioeconomic health indicators, particularly in the most southern part of my riding. And they were made without regard to a robust public transportation system. My office over the past year has made numerous FOI, Freedom of Information, requests to Kevin Smith and to the Niagara Health System for information. And none of that information has been provided. And although we're using public health dollars in a public system. Some of these cuts are certainly driven by frozen hospital budgets by the Liberal government. But I think today is about calling on the NHS and calling on the Ministry of Health to be transparent, to be accountable. The need for a review for the plan for Southern Niagara and Niagara as a whole, with facts and figures that are validated by expert studies that will support good, safe, reliable patient care for years to come in Niagara. And so at this point, I call upon Eric Hoskins, the Minister of Health, to review the plan and to review the recommendations after he has an opportunity to review Dr. Lister's report. Thank you so much.
Thank you. Next is Sue Hutt. Sue is the co-chair of the Niagara Health Coalition.
Thank you. We've been very active for the past 5 years in the Niagara Peninsula, really fighting the various decisions that the NHS has made to close beds, close services, etc. At the present time, we have 2 campaigns, one to save the Welland Hospital and one to save the Niagara-on-the-Lake Hospital. And as of yesterday, the Niagara-on-the-Lake Hospital, although it will still be open, it has been reclassified as an ambulatory center, and there will be no more beds. We're concerned about the decisions that were made to close all these various hospitals, and certainly all the concerns that we had have been brought up in Dr. Lister's report. Presently, what we have in Welland is a very robust campaign. We have a petition that's going on, and basically it focuses on this, that the decision to close the Welland Hospital was made without consultation with the residents of Niagara and without regard to the potential social and economic impact on this closure. And we have thousands and thousands of people who have signed the petition already. They want the minister to stop the planned closure of the Welland General Hospital. They want that there's a proper evidence-based study made to assess, I should say, the present and projected health care and hospital services requirements of the residents in the catchment area of the Welland Hospital, and to hold public consultations, and that's very important. We have had numerous public meetings. We've had inserts, flyers in the papers. We will be doing presentations to municipal councils, and certainly Welland Municipal Council is very favorable to what we're doing. Port Colborne, the mayor and numerous councillors are favorable. Wainfleet, the same thing. We are trying to mobilize the population, and we've done a number of things, like Dr. Lister talked about the travel time. We actually had people go from various areas in the catchment area to the new site to see how long it would take. So it's very important to bring forward all our concerns and really have the minister revisit what is going on in the Niagara Health System. La fermeture de l'hôpital de Welland va affecter plus de 90 000 personnes dans les communautés de Welland, Port Colborne, Waynflete et Pelham. Et puis, en plus, 2 de ces communautés ont déjà une population d'au-delà de 60 ans. Et c'est très important qu'on continue d'essayer de garder cet hôpital ouvert. Merci.
Merci. And Franz Gelina, the NDP health critic.
Thank you, Natalie. As it was mentioned, my name is France Gelina. I'm the MPP for Nickel Belt and the health critic for the NDP. La situation aujourd'hui est simple. Dans la péninsule du Niagara, nous avions 8 hôpitaux. Il y a une décision qui a été prise d'en fermer 5. Cette décision a été prise suite à des rapports. On a demandé au docteur John Lister, qui est un expert en Angleterre, d'analyser ces rapports. Son analyse est troublante. Les données qui ont été utilisées pour justifier la fermeture de 5 hôpitaux ne tiennent pas la route. On n'a pas regardé à la démographie de la région. On n'a pas regardé aux besoins des gens qui demeurent dans cette région-là. On n'a pas regardé à quel était le niveau de santé de ces gens-là, quel genre de programmes et services ils auraient besoin dans ce moment et dans le futur. Et on n'a pas regardé ni au volume, ni au nombre de lits, ni aux besoins de transport. Donc, c'est la raison pourquoi la députée Cindy Foster et mon collègue Wayne Gates demandent au ministère de la Santé d'arrêter la fermeture de ces 5 hôpitaux-là et de s'assurer qu'on a des données de qualité pour prendre des décisions éclairées. As the NDP health critic, I have seen how private partnership have affected our hospital. I have witnessed the devastating effect of hospital closures on communities throughout, mainly rural and northern Ontario, and now we are witnessing staff layouts and cuts in hospital programs throughout our province. Today's news is specific to the Niagara region, and it is another example of short-sighted, unjustified, and unfunded cuts to our hospital system in that region. It is a vivid demonstration of what happened when there is poor planning, or I would say when there is no planning. As Dr. Lister has basically said in his report, there is no valid scientific data to justify the decisions to close those 5 hospitals. All over Ontario, we see the effect of hospital overcrowding. And as my friends and colleagues have said, and as Dr. Lister has said, overcrowding leads to problem, leads to consequences, and none of them are good. The hardworking families of Ontario deserve an accountable and transparent healthcare system, and they deserve transparent and accountable decision-making. None of this was available to them, which is why the people of the region, the MPP representing the region, want an immediate stop to the continued services cuts that are happening in the Niagara region, and I am there to support them 100%. Merci. Thank you.
Thank you. So just to conclude, the people of Niagara have been served a very bitter pill. Thank you. Amalgamation was meant to capture administrative savings. It was not meant to be a carte blanche to close down hospitals, but that is what it's being turned into across Ontario, and the worst case being in Niagara. The supervisor that the Minister of Health sent in just prior to the last election in response to huge community outcry in Niagara over the deaths of more than 30 people as a result of a C. difficile outbreak in the Niagara health system, came up with a report just a few months after being appointed as supervisor and taking over the hospital that recommended the closure of 5 entire hospitals. The callous disregard for the patients and the people of Niagara in that report is made vivid by the fact that the supervisor only even mentioned superbugs or hospital-acquired infections once in the entire report, did not in any way provide any detail of an investigation into the deaths, any way of preventing future deaths, and in fact set out a plan that would increase hospital occupancy to even more dangerous levels, to levels that are unheard of in the entire industrialized world in Niagara. And so the people of Niagara expected a supervisor that was going to deal with the C. difficile outbreak and restore public confidence. And instead, what they came up with was a plan to close down every hospital across southern Niagara and possibly replace it with one maybe 10 years down the road with actually no guarantee whatsoever of any level of service. And this is for a hospital that is already overall running at 102% capacity, and as Dr. Lister said, in complex continuing care beds, running at 93% capacity, which is going to go up to 97% capacity with the closure of the complex continuing care beds in Niagara Falls. This is irresponsible. We are asking the health minister to take a sober second look at the plans for Niagara. We fear that patient lives will be threatened by this, further threatened by this. We fear that people will have perilous lack of access to health care. It's a very serious issue, and we're very concerned that if these 5 hospital closures in one region are allowed to go ahead, that we'll start to see hospitals in small and even large towns. Welland is 50,000 people. Niagara Falls is about 50,000 people as well, being closed down. Thank you. Any questions? Questions? Okay, no questions.